Local Branch Mangaluru, in association with Srinivas College of Pharmacy, VALACHIL, Mangaluru.
Before we begin with the scientific session, we ask you to please turn off your cell phones and electronic devices or put them on silent mode during presentation to minimize distractions. We encourage the audience to actively engage after the presentation and maintain decorum.
I request the chairperson, Professor Pratibha M. and Dr. Viresh K. Chandran and the speaker Dr. Mithun S. to take seat on the stage.
I request Dr. Shripati D, Professor, Srinivas College of Pharmacy, to florally welcome Professor Pratibha M and Dr. Mithun S. We have with us Dr. Viresh Chandran, Professor, Department of Pharmaceutics, Srinivas College of Pharmacy, Mangaluru. He has completed doctorate from Srinivas University under the guidance of Dr. A.R. Shabaraya. We have with us another chairperson, Professor Pratibha M, Principal, Srinivas Institute of Nursing Sciences, VALACHIL, Mangaluru. Sir has completed BSc Nursing from Raju College of Nursing, Hassan, RGHS, Bangalore, and MSc in Community Health Nursing, Raju College of Nursing, Hassan, RGHS, Bangalore. Currently pursuing PhD in Nursing under Srinivas University, Mangaluru. Sir has 15 years of teaching experience.
I request Sir to introduce our speaker, Dr. Mithun S., Associate Professor, Department of Psychiatry, Srinivas Institute of Medical Science and Research Center, Mukha, Mangaluru, to the gathering and picturing session.
Very good morning to all. It's my honor and pleasure to introduce Dr. Mithun S. Dr. Mithun S, MBBS, MD, DNP Psychiatry, is an assistant professor in the Department of Psychiatry at Srinivas Institute of Medical Sciences, Mukha, Bangalore. Sir is a psychiatrist with extensive experience and diverse academic background. Dr. Mithun completed his MBBS from Kempegowda Institute of Medical Science and pursued MD in Psychiatry from St. John's Medical College, Bangalore, as well as DNP in Psychiatry. Additionally, he holds an MRC Psych from Royal College of Psychiatry, United Kingdom. His professional journey includes roles such as junior resident in the neurosurgery department at Kempegowda Institute of Medical Science, Bangalore, research associate in ICMR project at St. John's Medical College Hospital, Bangalore, focusing on autism spectrum disorders, and senior resident in the Department of Psychiatry at DGS Global Institute of Medical Science, Kengeri, Bangalore. Apart from his clinical and academic responsibilities, Dr. Mithun served as the member of Secretary of the Institutional Ethics Committee at Srinivas Group of Institutions and is a member of Medical Education Curriculum Committee at Srinivas Institute of Medical Science, Bangalore. Sir has presented and published numerous papers in prestigious conferences and journals. Dr. Mithun is also recognized for his contribution to community health awareness program and has received several awards for his academic excellence and cultural achievements. Today, Sir will be the speaker on the topic of fiction-based psychological learning for professional ethics in patient care. Okay, with this brief introduction, I welcome Dr. Mithun S. for this gathering. Over to you, sir.
Hello. Good morning, everyone. Good morning, everyone. Yeah. Firstly, I would like to thank Srinivas College of Pharmacy, Dean Sir, Shavraya Sir, convener, co-convener, coordinator, the organizing committee, and Satish Sir, and the volunteers, and also my chairpersons Pradeep Sir and Veeresh Sir, for giving me this opportunity to be a speaker and share my viewpoints with the pharmacy students. And secondly, I would like to congratulate Srinivas College of Pharmacy for holding such a wonderful conference and association with the Indian Pharmaceutical Association Mangalore branch. And Dean Sir walked through the poster presentation, the art making, and also it is a wonderful job done by the volunteers. The number of posters were more than 200, and it's a commendable job. I think you deserve a round of applause for yourself, a big round of applause for yourself. Then, lastly, to begin my presentation. So, this presentation is called fiction-based psychological learning. So, what is this presentation and what is the fiction? How can you learn from the fiction? Basically, the anime, the cartoons, and what is the role of a psychiatrist or a psychologist in pharmacy training? I am actually in touch with some of the pharmacy students. Some of them are here. Some of the seniors, Dr. Vilas, and some of the fiction was given suggested by your batchmate of Srijal. Then now Dr. Raghav. So in the coming slides, I will tell you what is it and what is the rationale behind this everything. So in the beginning, the MC told that after the presentation you can interact, but I would suggest during the presentation also you can interact. Any doubts you have to ask or anything, and you can do so. So my level presentation is basically because this is the 6th National Conference of Innovative Practices in patient training and in clinical training and patient safety. So my level presentation objectives will be how, with the help of fiction, that will help in my clinical training and patient safety. So for this, when I discuss, the audience will be mainly pharmacy students, B Pharma, D Pharma, and pharmacy students. When I had a discussion with Satish sir, so I just gave an idea. So what is it that can be relevant and which is like understandable to you, which you can take home? Message was like, then sir suggested me few tips. So I went through your website, India Pharmaceutical Association, and most of you are very well aware of this more than me. So in that website, I went to the GCP guidelines. So that is good clinical practice guidelines. So in that, it is a collaborative guidelines made by multiple authorities and apex bodies. As you can see, the Ministry of Health, MOH, DCTI, and the ICMR has drafted guidelines for research in human subjects. And this DCP guidelines came into picture at the national level by these apex bodies. But as part of the international collaboration of the Declaration of Helsinki, the WHO guidelines and ICH requirements for good clinical practice. So good clinical practice will be both your practicing of your clinical training and also the patient safety. How that is relevant to your branch is basically, I will be explaining in the coming slides. So ICH GCP is nothing but International Council for Harmonization of Technical Requirements for Pharmaceuticals for Human Use. Guideline for Good Clinical Practice GCP, which is an international agreed standard that ensures ethical. So because I was part of the ethics committee and this is very much relevant to me, and also because ethics need to be practiced in your course, in your syllabus, your practicals, and also your research projects, everything. So these guidelines I thought will be relevant for you, and to explain certain principles of these guidelines, linking that with evidence-based psychology via fiction. I felt it was very relevant and an innovative way of putting across my ideas about these principles to you. So, ethical and scientific quality in designing, conducting, regarding and reporting trials that involve participation in human subjects. The latest guideline is E6R3 released on 19 May 2023. But the current version, which is there in the website, if you have seen, that there are about 13 principles with respect to the ethics research, is E6R2 released in 2016, from which I have taken the principles. So, what is the role of a psychiatrist, or how a psychiatrist speaker or psychology in pharmacy is important, because it's mainly concerned with the ethics. So, what is the ethics? Ethics is mainly concerned with your thoughts, which is related to the mind, and we are the mind specialists, so that is where we come into the role. So, as you can see, ethics is about your morals, morality, about your values, the dilemma, the complaints, benefits, choice. And ethics, just before my presentation, there was a presentation about communication skills, how you counsel a patient. So, counseling again comes to a part of the psychological training. Psychiatrist also comes to your play there. So, not only ethics need to be followed in communication skills, communication is your verbal as well as non-verbal communication skills, but it's also ethics need to be followed in your practicals, in your pharmaceuticals. These are the subjects which you know in your semester-wise subjects is there. So, quality assurance and biostatistics and research methodology, where obviously ethics are followed. That's why we have an ethical committee. And your project work and clinical trials. And very much important, some of the poster presentations which we were going through in the morning were also about some of the clinical trials or some of the extracts or how they have done interventions, not only observation, not only AAP studies, but also intervention studies were there, where also you need to follow the ethics. So, drug discovery and clinical evaluation of new drugs, whether it is in the drug discovery phase, preclinical evaluation phase in the animal phase, or the clinical trial phase, where actually will be the participants will be human subjects, human participants, and your phases of clinical trials and pharmacovigilance. In all these aspects, ethics plays a very important role, and ethics, not that only psychiatrists have the upper hand in ethics, but we have a role in teaching the ethics, because it's about the thinking, about the mind, and so that's why a speaker of psychological qualification or psychiatric qualification will be might be relevant in this context. So that is the link between psychology and pharmacy, and pharmacy students are also posted in psychiatry, where we teach them, they observe and learn how to counsel the patients, and whatever is relevant to them, the ethical part, they do observe that and learn from that. So this is the link between psychology and pharmacy. So now coming back to this, now during COVID time, it was a very hard time for all of us. So during that time we were in isolation. So means we had to do the hospital duty, we had to counsel the patients. So patients who are in the ICU, we had to wear a PPE kit, and then we had to go and counsel the patient. They can't see our face. So sometimes they get scared because we are like ghosts when we wear the PPE kit. You would have seen it circulating on WhatsApp media. Person goes in the PPE kit and patient gets afraid. So that was a very tough phase. So during that time where we are not in touch with our family members for nearly 6 to 7 months, we were in isolation. So during that time, I was needing some source of inspiration that as you know, most of them are very much, they watch the anime, cartoons, fiction. So you may not read your syllabus, but you have a list of what anime you have watched. All of you are subscribed with Netflix, right? None of you would have, not all of you would have gone to the website which I mentioned, your Indian Pharmaceutical Association, but all of you are subscribed to Netflix, OTT, or WhatsApp, everything. So you are well versed with that. So same thing with me. So then during that time I was writing a narrative review for my promotion for my publication. Then I got an idea. Then while I was going to the YouTube, I just came across Shark Tank. So then I thought, why not, instead of making a review, why not making a YouTube channel? Then I applied to the copyrights for the government of India, and I got my copyrights regarding my idea, that is healthy aging by fiction spirituality with play and relaxation therapy. So now my subscribers, most of them are students, some of them are pharmacy students themselves. So, and there are 900 subscribers. I am not promoting my channel, but still, you can go to the channel later, I'll share the link. So basically, if you see that I have explained many concepts about with the help of fiction, like Joker, what is chaos theory. Chaos theory, like especially during COVID time, some of whom you have lost your loved ones or your family members, how you can come across or come out of it. So some of them I have explained with the help of the cartoons. But for this presentation, with the help of the anime, I'll be explaining 13 principles about your GCP guidelines with the help of certain relevant anime, which I have watched. Probably most of you would also have watched it. So first principle is about ethics. So why has ethics come into picture? So basically World War II, everyone is aware that during that time a lot of human trials were done, which were unethical. So to make streamline that, just because some group of people in some part of the world they were unethical, they did not stop the human trials. They told that human trials used to happen. For that they put that the ethics forefront, that is 4 pillars of ethics: autonomy, beneficence, non-malefacence and justice. So for that they put a declaration of Helsinki. In that they told that you can do the pharmacy, you can do the human trials, no matter which field, whether medical, pharmacy or any other, but there needs to be certain guidelines which need to be followed. Why? That was based on the thought with the hope that what mistakes were happened in the past that does not repeat again in the future. So that is when your declaration Helsinki came into picture and good legal practice guidelines in the form of DCP. So the principle behind this was the hope. In psychology, especially for psychology students, we tell this. Hope is one of the first virtue of Erickson's psychosocial development. So hope is also very important virtue for to come out of the depression also. So in this context, hope plays a very important role, that hopefully you don't commit the same mistakes that happened during the past, so that just because someone stumbles and loses their way, it doesn't mean they are lost forever. Sometimes we all need a little help. So that help is from the ICH GCP guidelines. So whenever we follow the human clinical trials, we should not lose the hope of harming the patients, but you need to follow the guidelines and do the clinical trials. So this is a beautiful scene. I don't know how many of you have seen this. This is a clipping from the movie Explain Case of the Future Past, and it's a very beautiful scene. And this is my video which I have explained in my YouTube channel. Second, so now we know what is ethics, why ethics has come into picture. So basically, the simple bottom line principle behind ethics is that majorly it has to be good. It's like democracy. See, what is the majority in our country rules us. So whatever trials we do, 100% it cannot be foolproof. See, we can be experts. All of us can be experts in our respective field, but we cannot be perfects, except for Abhirna, who is Mr. Perfectionist. But we can only be experts in our field, so mistakes are bound to happen. But majorly, if it is good, then we follow those ethical guidelines. So majorly, the benefits which are in the ethics which are following, the benefits are more than the risks, which usually you assess in the drug discovery phase or the preclinical phase in the animal experiments. If the benefits of the drug or the extract of the drug, pro-drug or the active drug is more than the risk, that is when you need to carry on with the research, because that is what is research. In Kannada they say Pratyaksha control Pramanisi model, means what appears face validity. So you may see, say during the COVID time, they may say if you take lemon water, that will kill the coronavirus. That is the face value. But for other things, you have to go and do a research. You may not know what is going to happen. So that is what the first impression effect. That is on the lines of Beauty and the Beast. I think all of you would have seen the movie. Beast, when you look at the beast, you may feel because it's ugly, the person that beast may be harmful or dangerous. It can be a other way around also. If the person is beautiful, that person, you may think the person is good and very sober. May not be so. That's why that's called the first impression effect, attribution bias. So bias is something which happens in research where ethical principles need to be followed. So this first attribution bias can be overcome when you have a strong protocol where the benefits should always outweigh the risks of the clinical trial. So who had ever thought that this could be true, that is no Prince Charming, but there's something in him that I simply didn't see. So first time when you see, you may not find something, or first time when you see, you may find something. But to find that causal relationship or that association, that is what is this all about research. That is what you do in your practicals. So now we have to try on the human subjects. So, but humans are different from animals. So you have to empathize with the human subject. So that empathy, one of the ways of empathizing is called a mature defense mechanism called self-observation. For this I have taken an example of Tom and Jerry. I think all of you have seen Tom and Jerry. I think even our senior professors during childhood days, they would have seen Tom and Jerry. There's no one who has not seen Tom and Jerry. As you have not seen Tom and Jerry, see, everyone has seen the Tom and Jerry. That's the reason I have taken fiction, because half the job is done. It's because I am able to connect with the people, especially with the students. Because it is a universal thing now. Now everyone watches fiction, anime. and it's easy to communicate. It's a part of our therapy called superhero therapy. I won't go into the details of that. That's for psychological students which you do. So self-observation, what happens in Tom and Jerry? Tom always troubles Jerry. But when the dog Spike comes and troubles Tom, so that time Tom realizes that what trouble I was giving to Jerry when the Spike used to me, I should stop. So he starts empathizing. It's called self-observation. Start putting yourself in other shoes. For example, if you bully your junior, if you rag your junior, when your senior comes and rags you, that time you realize what ragging you have been doing, so that is wrong. So that time you start empathizing. That is called self-observation, defense mechanism. So with this you are able to empathize. So whenever you are doing a drug trial on a human subject or your human participants, when you put yourselves in their shoes and see that in case I am taking the drug, the benefits may be better than the risks as per the preclinical trial, but will that cause any harm to the patient? So always the empathy should be better than your experiment results. So your experiments may show that the benefits more than the risk, but if it is not for the patient safety, then it should not be done. That's what is the ethical principle. That's called empathy. So this is the third principle as per the GCP guidelines. So be good to get good. So what you give comes back to you. Next is obviously now once you have done the preclinical trial, now you know there is some research question and you have identified research gap. So next has to be your further review of literature. So the review of literature, you may find some research idea that you like. So what happens that when you go and keep doing more and more research, that research idea may not fulfill a research gap. So you may emotionally be connected to that research question, but logically there is nothing which can come out of it. So that the thing which you need to do is your common sense need to prevail over your sixth sense. I think all of us have only five senses. Does anyone have a sixth sense? That's called gut feeling. So what you feel, it's called emotional reasoning. I think this may be correct. I think if I write for this question, if I write this answer, I may get more marks. So that's called gut feeling. Sometimes that may work in your viva or in your theory papers, but in ethical practice of your research, your common or logical sense. Common sense is basically the sense which is common in terms of research. That is your ICP guideline which you need to follow. So your common or logical sense should always prevail, not always majorly should prevail over your gut feeling or sixth sense, because your gut feeling or sixth sense may be misleading. Cognition derived may be emotionally driven than logically driven. So you should empathize with the patients. You should be emotionally connected with the patient, but not with the research question or not with the research gap. That should be logical connection. So you need to have a proper logical reasoning after the review of literature before you proceed with the protocol. So see that line, Mona. This is from the Mona Disney movie Mona. So see that line where the sky meets the sea. It calls me, and no one knows how far it goes. So similarly, when a research question, you get an idea. See, you can get research ideas. Anything under the sun, you can do a research. And when you get a research idea, as I told the first impression, you need to give more time. You need to give more efforts, put in more efforts to know what is the outcome of the research idea. So then further, you have to do a further review of literature and further try to understand what is there. So unless you put in your efforts, unless you do a further research, that's what happens. Your bachelor's, your master's, then your master of philosophy goes on. So more and more you advance in your educational qualification, the more and more you need to be transform yourself not only professional but also in your personal experiences. So that's what the fourth principle, that information what you gain should be more rational, logical rather than emotional or gut feeling. So principle 5 is good quality evaluation. So now we, for MBBS, there is something called a CBME. Your friends or your brothers, sisters who have joined MBBS, they know. Now it is called competency-based medical education. I know Apartment knows about that. So competency-based medical education. The curriculum of MBBS, what we learned after it was the 1987 draft. So nearly after 30 years they have changed. Now it is to make it competent. So competence in psychology, the definition of competence is there is a elaborate definition. I won't go into the detail of that. But your whatever trials you are doing, whether that is on par with the other trials. See, no one expects you to be your trial should be super or exuberant but it should be at least be competent enough to come into the poster or for a publication or as a part of your thesis. So for that, for competence, you will need to have a good quality evaluation. So failure is the stepping stone for success. So I think all of you would have seen the movie The Dark Knight. So why do we fall? So that we can learn to pick ourselves up. So it's only by experience is the best teacher. So when you fail, you try to learn from mistakes what you have done and correct those mistakes. See, it's but human error to do it's but a human nature to do errors. It's called error, trial and error. So when you do the errors, you learn from those errors so that you don't repeat the same mistakes again. So mistakes are still acceptable, blunders are not acceptable. That's what is called negligence. Your area, all those things. That is where your area, monitoring, everything comes into picture. So if your competence, you should be competent enough to evaluate not only theoretically also but practically, so that during that evaluation you may come across many failures, but still you have to overcome them to be competent enough with the other on par with the same university or with the other university or other nationally or internationally. Don't start taking mask and then because I was told in the conference, I'm just giving the example. It's a rhetorical example, that's all. So the competence can be learned from certain things. That is the basic idea behind this. Next, so once you have done the evaluation, then you know project work. There is a deadline. You have to submit the project work. Now our students, those who are in final years. So now within a certain time we have to submit our project work. There's only 3 months time. If you don't submit, then these are questions. They'll put fine. All those that I will try to tweak your results, or you will try go to the statistician. You go to the statistician's house. You stay there with the statistician for 2-3 days to get the evaluation done. So you try to be not compliant with the ethical rules, but it always takes a willpower, your will, to be compliant with the GCP guidelines, so that your trials need to be effective and also competent enough. So willpower, Captain America in the movie First Avenger. So we may not be perfect, as I told, none of us can be. Expertise is the goal. So when we reach we may not reach the ultimate goal, but closer to the goal is the aim of that. So we may not be perfect, but the safest hands are still our own. So our hands may be safe with us, but when we are dealing with the other patients especially, we have to take care of their safety also. So for that, being compliant with your ICGCP guidance in terms of the research protocol and other your regulations, whatever your etiquette needs to be followed, for that takes a lot of willpower. So that willpower can be one source of inspiration is Captain America. You know the famous dialogue, I can do this all day. So I can speak about this all day, but the time limit is only about 30 minutes for me. So it's about willpower. That is the 6th principle compliance. You can learn from that. And this dialogue is my favorite. Whenever I am down, I look into this, and everyone knows about this. So responsibility. So whatever trial you do, whether it is a success or a failure, you are responsible for that. You cannot put the responsibility on your teachers. So my sir told, my ma'am told, so you cannot just shun away your responsibility. My care is responsibility. So you cannot do that. Whatever you are doing, you should take responsibility for those actions. So you are the decision makers of your educational qualification and also the decision making of the life and the safety of the patients on whom you are doing the trials. So with great power. So you have the power of what? Knowledge of your pharmaceutical practice, and which needs to be come into effect with your attitude. So that attitude in terms of empathizing the patients, which it has to come into practice. Practice in the form of ICH, good clinical practice. So with great power comes great responsibility. So that is based on the fidelity virtue. Fidelity virtue means faithful. You have to be faithful to your professional ethics. You have to be faithful to your guidelines. So that is what is called professionalism, professional ethics in your ethical guidelines. So no matter what, personally you may be going through a lot of difficulties. You have to segregate that, and you have to be professional when you are in the professional setting. Okay, so because you are the decision making of, sometimes the decision making may be a life and death situation for the patients also. That's what is called your ADS or idiosyncratic or your negligence considered picture. Your penalizing code, all those. So principle 7 is the responsibility. You should take responsibility of that. Next is your qualification. So I think all of you have seen Lion King Simba. So what is the purpose of you doing the research trial or your clinical trials or your B Pharma, D Pharma? Is it only to obtain a degree? But what is the ultimate purpose in your life? So that you give your service to the community. So if you have purpose in your life, that gives you some degree of satisfaction, also gives you a particular clear goal where you have to go through. So the purpose is look inside yourself, you are more than what you have become. So as I told, see, professional courses are called professional courses because there's a certain level of professionalism which needs to be followed, and that change can happen right from your first year to final year. So that change happens as you grow in your knowledge, you grow with your age, you grow with your maturity, you grow with your wisdom also. So the ultimate purpose, if you have a purpose in your life, that you have to make good clinical trial. With that, if you get a patency and if you get the patent of the product, like similarly what I have done with my concept of copyrights. So if you get a patent and if that patent clicks, then the rest of your life, your purpose of your life is served, and your future relations, your family, you can take care of them well. So if you have a particular goal, if you have a purpose, that's what is Shark Tank, all the startups or everything they promote. Some of them is for the TRP also, but practically if you look behind the idea behind that is to promote idea generation, so that there is a purpose which you serve for the betterment of the human society and the civilization. So this can be learned from the Lion King Simba. You know that he gets lost and goes away from his kingdom, but later he gets reminded by his girlfriend, that's Nala, telling that you have to come back to your kingdom and rule the kingdom. So that is your purpose. You have to become the king. That is called the circle of life. So similarly, when you have a purpose, you will get a purpose in your life, and that completes the circle of your life. So that is the principle A, qualification. Whether you are qualified to serve the purpose which you are actually supposed to do, and the purpose may be served to you or given to you from the university, but what is your personal purpose, you need to look into yourself. Principle 9, Avengers Endgame. So when you know there is a good clinical trial, and you know the benefits are always better than risk, and it's also safe for the patients, but you cannot force any research on the patients. You should participate in the patient. You should participate in the research. No, that is what against that. That's what happened in World War II. That's why in the regulation came into picture, where the autonomy of the decision making to be a part of the research is with the patients. So you cannot say this research is inevitable to the patient. It is left to the patient whether they can snap their fingers or they sign for the consent. So it's left to the hands of it's left to the decision making of the patient. That's what the principle behind the consent, that you could participate in the research. It's not that you should participate in the research. You could participate in the research. These are the benefits. These are the risks. So if you want to drop out, you could also drop out from the research. So that autonomy is a part of your ethical principle, which is a part of your ECH GSP guidelines. So don't be like Thanos of being should, that where he had to erase half of the universe. But be like Iron Man of being good. Even Iron Man also could do the same thing. Whatever Infinity Stones he got, he could erase the but he did not do that. Because he could do that, but he chose not to do that because that was the ethical thing which he had to do. So similarly, when you are taking the consent of the patient, you have to be transparent about your research and give all the patient information sheet to the patient and do the research not only in your project work but in of your practical aspects, your practical subjects like your pharmaceutical, industrial pharmacy, and all the other branches of your semester-wise subjects. So principle 10 is the data. So data, finally, what is ultimately the outcome of your data, of your research? The data is what is your power. So you have to protect your power. You have to fight for your data. So always when the publication happens between the students, there is always, I am first, put me as the first author, put me as the second author. So fighting always happens there. So whoever is putting more efforts, whoever is putting more ethical efforts, that person should be in the forefront. So that care should be taken. Your data should be carefully handled, because once you get the data, you can play with the data. But that care about the data needs to be there in terms of data collection and also data analysis and data projection also when you are doing a publication or when making a post presentation. So the power of data comes in response to a need, not a desire. Just because you want to be first author doesn't mean that I need to be first author. Just put my name, that's not going to happen. You have to put in your efforts, you have to take care of your data. You need to get that power of the knowledge so that you are in the forefront. So that is what the principle has to be. That is the 10th principle. The data collection, analysis and projection should be ethical. So this can be learned from Dragon Ball Z. Principle 11 is confidentiality. So confidentiality, when you are public, post presentations, when you know the principle is that you should not reveal the data of the patients because nothing has to be made public. That is one of the principles behind this. And when you are taking the consent of the patients, also confidentiality is maintained. But there are certain grounds where you have to breach the confidentiality. Grounds of breach of confidentiality. So that wisdom when to breach the confidentiality, that can be learned from Kung Fu Panda. That is what I told. There is always something more to learn even for a master. That's what I told. See, learning is a lifelong process. In CBME, for one role of the IIT, Indian Medical Graduate is being a lifelong learner. This is student life is a golden life. So if you learn for the entire life, so your entire life can be golden life. Theoretically, that's what it goes as the saying goes. So the wisdom can be learned from a lot of quotes. You know this famous quote: "Yesterday is history, tomorrow is history, today is a gift." That's why it's called the present. So make use of the today's time and don't waste it. And that wisdom of maintaining the confidentiality also. Same thing happens with your placebo or nocebo. See, placebo response is something which a patient feels. To make something special, you just have to believe it is special. So when you give a drug, patient may improve within 1 or 2 days. But you need to have the wisdom to know that, see, the half-life of the drug or the plasma half-life, the steady state, and the onset of action of the drug is say about 7 days. For example, in psychiatric lithium. So one patient when he takes 1 dose of the drug, he feels I am 100% okay. But a wisdom should tell that no, that's not going to happen. Because the onset of action of the pharmacodynamics of the drug is itself takes about 1 week. So why is this not happening? So this analysis comes with wisdom and that can be learned from this fiction, along with the confidentiality. That is the 11th principle. Then good manufacturing practices, that is you always need to affiliate. Why there is an affiliation? See, every college needs to be affiliated with the university needs to be affiliated with the national apex body. Affiliation is for like seeking help. See, as I told, no one is perfect, so there is no harm in seeking help. When you don't know, there's no, it doesn't make you small to tell that I don't know, please tell me or please teach me. That's why learning is a lifelong process, because there's always something or other things to learn. So as you go by, once you pass out, you may get a degree, but that wisdom and that maturity or the knowledge may still be in the process. So always affiliate with the apex bodies for good manufacturing practices. That's what you can learn with it's kind of mature defense mechanism called affiliation. See, that's what seeking professional help. This is especially saying as an awareness for patients or students with depression. If you are going through depression or anxiety, don't keep to yourself. Come and seek the professional help. Shakatanda Bandha Tirtha, they say. So some advice may be given. What advice we give? Similar advice may be given by other friends also. But professionally, we are expertise in our field. So the way we advise them may touch to them rather than others advising them. So there is no harm in always asking for help. So do not be fooled by strong face appearance. Like so many things, not what is outside, but what is inside that counts. So on the outside, on paper your research may be perfect, but inside you may know that these are the loopholes. For that, you need to ask help how to overcome that. So for that, you have your teachers, your seniors, and your other affiliation apex bodies. That is the principal term. That is for good manufacturing practices. Always affiliate yourself with competent people. The last one is, Naruto's son is also there. I won't go into the son. So now quality assurance. Quality assurance is like how will you ensure quality? See, quality. You may think what you have done is the best. No matter what you do, for your teachers, it's always like you can do much more better. So the thing is that it's called fallacy of fairness. Hard work is worthless for those who don't believe in themselves. So do your part, what you are supposed to do, follow the ethical guidelines, follow the rules, regulations which need to be followed, and do your part. Be process oriented rather than being outcome oriented. Because the outcome of it, you cannot guarantee, you cannot predict what is the outcome of the research at the beginning of the research. It may be either way, it may be positive or negative. So don't be disheartened by even if it's a failure. As you told, you can always learn from the failures. So be process oriented. If the process is fair, and if you're fair enough with the process, definitely the outcome also is going to be fair to you. So that's called fallacy of fairness. Be fair to yourself. Be fair to your work, rather than expecting the world to be fair to you. So that ends my presentation. Thank you all. Any questions? This is the link of my YouTube channel. This is my product promotion. So if you have like this presentation, you can go to this and like, subscribe, share, and don't forget to the bell icon. Thank you. Over to the chairpersons.
Now the session is open for delegates. Any queries? Any questions? You can ask us, sir. Sir has shared his view in evidence-based fiction therapy, related to mental health. So, fiction therapy it helps to explore the patient feelings, views, thoughts, as well as it helps to improve the communication skill, and it helps to increase the self-awareness. Right, sir? then tells for the emotional healing, then also tells for the individual and group therapy. Sir, I have one question in myself. So, as a psychiatrist, you have seen many different kind of psychiatric disorder and different kind of psychiatric patient. But for which patient this fiction therapy is very suitable? Neurotic disorder, psychiatric disorder patients, which kind of patients?
It's mainly for the neurotic disorders patient, especially in the children age group. See, because in adults we do cognitive behavioral therapy, CBT. There is something called as we identify there's some schemas, automatic thoughts, and everything. But with the children, when we start doing that, they won't understand it. So especially your 13 years and above, especially 13 to 19 years of age children who are still considered children as per the pediatric age group, till 18 years of age. They are adolescents, we can say young adults also. But above 13 years of age till 18 years of age, this is very much relevant because they are able to understand. Below 13, they may watch the cartoons, but what is the principle behind that? If I explain to them, they won't understand. So with less than 13 years, we mainly do with the behavioral therapy. That's called play therapy. Ata pata uta. During our times, that was the thing. So part of the uta madbeku, nutritious food, and also ata. Play is a form of therapy with the children. That's why if you see pediatric wards or second wards, there's something called as a play room for the pediatrics. And if you go meet some pediatricians in private clinics, there are certain play things for the children. So play is a form of therapy. So this is mainly beneficial for 13 to 18 years of age. But I think many of the pharmacy students, they themselves watch the anime cartoons and everything. Some of them were suggested by some pharmacy students also. So when students have neurotic disorders like depression or anxiety or like exam fear, in my channel sir, I explain how to overcome the exam fear or stage fear, how to talk in front of the stage. So with the help of the fiction, I have explained that. So when depression, when we communicate with them, if we ask them like for example Batman, so they are able to connect with because they are emotionally connected with the cartoons. Your kids at home, they watch cartoons. What is the reason children watch cartoons? Because they have that fantasy thinking. So with maturity, that fantasy thinking slowly changes to reality thinking. But during that transition stage, if you are able to impart certain values about say on evidence-based psychology like Eric Erickson's. So this can be taught in those neurotic cluster of people, especially between 13 to 18 years of age. I myself am 37 years of age, but I still watch cartoons. My parents still ask why are you still watching it. They want to understand what is the principle behind it.
Yes, sir. Now the children are addicted to mobile, even my children. So how they are behaving like by looking the cartoon or whatever fictions. They are in the fantasy world. So they are addicted to mobile. So you got any the addiction case in your the clinic or whatever universe? You got such type of cases?
Yeah, see, internet addiction is nowadays it's actually more than I would say an endemic rather than an epidemic. It's a pandemic. So everyone now before the case before the seminar presentation, announcement has to be made before every seminar that keep your mobile phone silent because everyone uses the mobile phone. That is the pandemic in every scenario. So internet addiction, as per our ICD-10 international aspect, there is a particular category for internet addiction, and in that we do behavioral therapy. We give counseling also for the children and also for the adults. And you would have seen certain cases being reported. Netflix addiction. One guy was admitted in IMAX and he was given therapy for about 2 weeks. In my channel, I have explained about addiction, how to overcome addiction using Cinderella cartoon. I have explained the help of Cinderella, how addiction happens and how you can overcome the addiction. In my channel, also one particular video I have explained. But internet addiction, as you told, one way of overcoming any form of addiction is discipline. Discipline is good. So using mobile is fine. But there is one particular time of the day where you have to use the mobile. So now during COVID time online classes, their students have to use the mobile. So even when at home, when children or they have to watch the cartoon, they watch the mobile, one particular time has to be given. It's called, we say, in the form of contingency management. Especially for small children, we do. It's like nothing is so granted. It's like token. It's called token economy. So what happens usually, children surrogate about the parents. So you bike is coding, now first time take it. So you will say first you buy me the bike, then I'll take first time. That is called bribery. And the lunch hour. So that should not be allowed in the home. What should be allowed first to take rent, then I'll get you the bike. So that is a token for the efforts which you have put in. So that disciplining can be bought in terms of token economy, which is part of the contingency management which we develop with the parents. And most of the times it's the other way around. The parents have to tell the children that we are the bosses in our home. If we cannot directly say this, but normally we have to tell that we are the bosses in our home, we have to follow our rules and regulations. That is for your benefits. That with multiple sessions we will be able to tell them.
Sir, you told YouTube channel, share your links so we will subscribe. Actually, with a big round of applause to the sir. As a doctor, we created one channel and it is adapted to the innovative practice for the psychiatric patient. That's why we need a big round of applause and he has taken the patient. Any other queries, sir?
Thanks.
Anything else from student side? Okay, sir, I thank Dr. Mithun for sharing his thoughts and views on new innovative clinical practice related to psychiatry. Thank you very much.
Thank you.
I would like to thank Professor Pradipayam and Dr. Viresh Chandra for being with us for the plenary session. And I also thank Dr. Mithun S. for a wonderful session. I request our principal, Dr. A.R. Shabaya, to present a memento and certificate to Dr. Mithun S.
I again request our principal, Dr. A.R. Shabalaya, to present memento to Professor Pradipa and Dr. Viresh K. Chandra. I request dignitaries to occupy the seats in the front row.
I request the chairperson, Dr. Gigi Jose, and the speaker, Dr. Aparna Sridhar Ahu, to take seat on the stage. Kumar Prasad sir to florally welcome Dr. G.G. Jose and Dr. Aparna Sridharaman.
We have with us Dr. G.G. Jose and Dr. Shripati B as another chairperson. Dr. G.G. Jose, Vice Principal, DM, Bibs College of Pharmacy, Wayanad, Kerala as chairperson. Sir is currently working as Professor and Head of Department of Pharmaceutics at Aster Dr. Mukherjee College of Pharmacy, Wayanad, Kerala. Sir has completed his B.Pharm and M.Pharm from MGSL Institute of Pharmaceutical Sciences, Mangaluru, and PhD from Jawaharlal Nehru Technological University, Hyderabad. Dr. Jose also has a patent and an authorship of one book in his credit. Dr. Jose is the life member of Association of Pharmaceutical Teachers of India and Pharmacy Graduate Association. Sir is also a member of Board of Studies of Kerala University of Health Sciences, Kerala. We have another chairperson, Dr. Shripati B. Sir was awarded degree of Doctor of Philosophy by Rajiv Gandhi University of Health Sciences, Bangalore. Under the guidance of Dr. A.R. Shabaraya, Sir has served as Assistant Professor in D.R. Karigowda College of Pharmacy, Hassan from April 2004 to September 2009 and in Karavali College of Pharmacy, Mangalore from May 2008 to September 2009. Thereafter served as Professor Srinivas College of Pharmacy since November 2009. Sir has 25 scientific research publications in national and international journals to his credit and has presented more than 5 scientific papers in national and international conferences. Sir is the recipient of Best Poster Award in 17th Annual Medicinal and Pharmaceutical Sciences Congress, Bangkok, Thailand in 2018.
I request Sir to introduce today's speaker, Dr. Aparna Sridharaman, Associate Professor, Department of Dermatology, Srinivas Institute of Medical Sciences and Research Center, Mukha, to the gathering and to chair the session.
Good morning to all. It's my privilege to welcome today's speaker, Dr. Aparna Sridharaman. Dr. Aparna Sridharaman, a consultant dermatologist, boasts an impressive 25 years of experience in medical field, with a particular passion for medical and aesthetic dermatology. Madam is dedicated to providing a personalized care her patient, drawing upon her extensive training and expertise gained from renowned institutions in the UK, Australia and India. Dr. Aparna began her academic journey by earning her MBBS and MD in dermatology from Kasturba Medical College, Mangalore, Manipal. Following her postgraduate study, she served as an assistant professor in dermatology at Yelagoya Medical College, actively contributing to the medical student education. Her quest for knowledge led her to pursue international training opportunities, including certified program in Wales, UK from 2005 to 2016 and in Australia from 2016 to 2017. She has acquired various international qualifications, including Diploma in Sexual and Reproductive Health from Faculty of Sexual and Reproductive Health, UK in 2008. Membership of Royal College of General Practitioners with a completion of training after 3 years program at Royal College of General Practitioners, UK in 2009. And Diploma in Dermatology from Cardiff University, UK in 2012. And fellowship of FAEG from Royal Australian College of General Practitioners, Australia in 2015. Dr. Aparna has also undergone specialized training in various aesthetic dermatology procedures including mesotherapy, laser and IPL safety, dermal filters and dermoscopy and skin cancer detection. Dr. Aparna has served as consultant dermatologist at Kaya Skin Clinic and Sparsha Super Specialty Hospital in Bangalore from 2017 to 2022. Throughout her career, she remains committed to the studying up to date on latest advancements in the aesthetic dermatology, regularly attending advanced training sessions to refine her skills in facial rejuvenation techniques using lasers, Botox, fillers, threaded lifts and microblading and medifacials and beauty glow therapy. With this, I request Dr. Aparna Madam to start her.
Good afternoon, everybody. I would like to thank the chairpersons, Dr. Shripati and Dr. Jose, for such a good introduction. I would also like to address our respected principal, the distinguished dignitaries which are present, and the delegates. So, the topic for today which they have given me is approach to adverse cutaneous drug reaction. I think it's a very pertinent topic, especially we have quite a lot of budding pharmacology students out here. So, especially because we are in this medical profession, we need to use medications in order to treat the patients. But apart from when we are treating the patients, we need to know what are the side effects and the adverse reactions as well. Because only if we know them, we can prevent or we can treat them. So I think everybody knows regarding this principle, that is primum non nocere. That means first do no harm. It is a part of our Hippocratic code, which is taken by all the medical professions all around the world. That is, you shouldn't be doing any harm to any patients. So day in and day out in the medical professions, we tend to use medications in order to get the desired therapeutic effects. But in an ideal world, an ideal medication is a rarity because even a simple paracetamol, it comes with its own side effects. So we all are familiar with this. That is the incidence of thalidomide, which is one of the worst examples of adverse drug reactions reported in the world history. So this was a medication which was given to pregnant ladies as a sedative medication against morning sickness in the late 1950s and 60s. And it was noted that following this, the babies which were born to these mothers had congenital limb defects as well as other birth defects. So coming to the topic as such, so what is an adverse drug reaction? It's a harmful or unpleasant reaction which results from the intervention related to the use of a medical product which warrants the prevention or specific treatment or alteration of the dosage regimen or the withdrawal of the medication itself. So, the adverse drug reactions, it has been noted that it is the fourth leading cause of death. They are responsible for around 3 to 7% of the hospital admissions, and during the hospital stay, at least 10 to 20% of the patients will at least suffer with at least one adverse drug reaction. coming to what we call it as urticaria, angioedema and anaphylaxis. Now, basically these are what we call it as typically an IgE mediated hypersensitivity reaction, which is which presents with what we call it as circumscribed skin edema and erythema. In case of anaphylaxis, it can be what we call it as the systems are also involved. So it is a life-threatening conditions in which you can have cardiorespiratory compromise, leading to shortness of breath, hypotension, things like that. Okay. So in case of drug-induced urticaria, sometimes you can have urticaria presenting with angioedema or with anaphylaxis. As I was mentioning, it's the second commonest type of adverse drug reactions. In children, basically it is the food which causes these reactions, whereas in adults it's mainly drugs. And when you come to the drugs, that it is the antibiotics which is most commonly which causes beta-lactam antibiotics, as well as painkillers, opioids, NSAIDs. Then during the perioperative period, you can have anesthetic agents or neuromuscular blocking agents which can lead to either urticaria, angioedema, or anaphylaxis. Recently, they have found that biologics are increasingly known to cause all these reactions. So, what is the pathophysiology? As I said, it's an IgE-induced drug reaction. So, what exactly happens is when the allergen it cross-reacts with the IgE, which is present on the surface of the mast cells, there will be release of the inflammatory mediators, and these inflammatory mediators will cause vasodilatation, it will cause smooth muscle contraction, as well as neuronal activation. So what are the clinical features which you tend to get in case of urticaria? So generally speaking, within around 24 to 36 hours of ingestion, you tend to get these reactions. But in re-challenge, when you are re-exposed to the same allergen, the reaction can occur much more quickly, sometimes even within minutes. So it is characterized by what we call it as wheals. Wheals are nothing but what we call it as these pale pink edematous papules of larves. Okay, they can affect any surface of your body. They can be of any shape or size. Okay, they are generally pruritic and they are what we call it as evanescent. Evanescent means these crops which comes, they normally last for less than 24 hours. So coming to angioedema, so as I was explaining, the principle of pathogenesis is similar, but the level of the edema which occurs it varies. It's much more deeper down in case of angioedema. So basically, in case of angioedema, it can affect even the mucosal surface. So you can have what we call it as a swelling of the lips. You can have swelling of the eyelids, and generalized swelling can occur in different areas of your body. Especially we tend to notice angioedema in the hands, the face. As compared to urticaria, there will be lack of erythema. So now coming to anaphylaxis, which is a life-threatening condition, it's a severe allergic reaction. So if you don't get treatment, the patient can also die. Okay? So food allergies are one of the most common cause of this anaphylaxis. But other things which can cause anaphylaxis is obviously medications, latex allergy, or stinging insects. In this case, what can happen apart from the skin being involved, in which case you can get the wheals, the redness, the itchy rash, you can have compromise of the airways, in which case you can have shortness of breath, you can have breathing difficulties, the patient may not be able to swallow. Okay, in case of the stomach being involved, you will have cramps, diarrhea, nausea, vomiting. Because of the widespread vasodilatation which occurs, there will be pooling of the blood which occurs, causing drop in your blood pressure, increased heart rate, and the patient can feel quite dizzy. So, events which has occurred before the reaction has occurred in order to find out what is the exact allergen which has caused these reactions. You can probably do a therapeutic challenge, but therapeutic challenge it comes with you can cause the reaction. So generally speaking, therapeutic challenge is only done by specialist allergy clinics, and that also under supervised monitoring. Similar goes to the testing with skin testing. So what is the management of urticaria, angioedema and the anaphylaxis? The main thing is to stop the offending drug. Once you stop the offending drug, obviously the disease resolution occurs quite quickly. In case of urticaria, we start off with low sedating antihistamines. Now if it doesn't resolve with one antihistamine, we tend to add on another antihistamine. And if that also doesn't work, then we escalate it by using a leukotriene inhibitor or a H2 antihistamines. In case of refractive cases, we sometimes tend to use what we call it as cyclosporine, methotrexate, omalizumab, as well as dapsone and colchicine. Now, in case of anaphylaxis, this is the drug of choice, epinephrine, either subcutaneous or iron. This is a life-saving drug. Okay. So, if anybody has anaphylaxis, according to the local protocols, you need to give them the subcutaneous or iron epinephrine. In some countries, EpiPens are available. If patients have had anaphylaxis more than 2 or 3 episodes, then they are advised to carry an EpiPen along with them so that they can immediately administer the EpiPen themselves. So coming on to the fixed drug options. Now again, this is the adverse cutaneous drug options, which is characterized by recurrent, well-defined lesions which occurs in the same area each time the offending drug has been given. So it can occur within 30 minutes to 8 hours after the drug exposure. So these are the medications which can cause the FDE. There is a long list, so I'm just going to So what exactly happens, the clinical features? So it is a classical form, what we call it as a delayed type of hypersensitivity reactions, and it is mediated by what we call it as the cytotoxic T cells which are present in the skin. So commonly affected areas are either the lips, the genital areas, the palms and the soles, and what you typically notice is all these lesions, what we call it as this round erythematous plaques which are present, and they tend to evolve into what we call it as this rusty color. So the investigation is oral provocation of patch testing. The treatment of choice is to stop the offending drug. If there are only few lesions, you tend to treat them with what we call it as topical emollients. But if there are loads of lesions, then you may need to give oral steroids. So coming to this condition which we call it as acute generalized xanthomatous pustulosis, it is a drug option which is characterized by what we call it as rapid appearance of erythema and sheets of pustules, and therefore the synonym which is toxic pustulodrama. So these are the positive drugs which can cause mainly antibiotics, antifungals, ACE inhibitors, diuretics, and anticonvulsants. So what are the clinical features which we can see in this? So basically, in case of what we call it as acute generalized xanthomatous pustulosis, the onset is between 2 to 5 days following the initiation of the drug. You can have a prodrome of what we call it as the fever malaise. The eruption generally occurs in what we call it as the major flexures like the armpits, neck, inguinal folds, inframammary areas. So you can get what we call it as this edema, which occurs with erythema, and on this edema and the erythema you can have what we call it as sheets of sterile pustules, non-follicular pustules. becomes severe. Sorry about that. When the skin involvement becomes quite extensive, you can have what we call it as electrodermal features, in which case you can have what we call it as heat loss, fluid loss, hemodynamic compromise. There can be secondary infection. It can be underlying what we call it as hepatic, renal, or pulmonary dysfunction. But once the culprit drug has been stopped, all these reactions they tend to settle within a few days, resolving with what we call it as post-inflammatory scaling. So in this case, we tend to do skin biopsy if we are not very sure of our diagnosis in order to what we call it as differentiate this between AGPE as well as pustular psoriasis, because it can present with similar pustules. And then we can do what we call it as, in order to rule out any underlying organ dysfunction, we tend to do renal as well as liver parameters, etc. The management is basically to find out what is the positive drug and stop it. If it is So in case of erythema major, basically EM major, you can have, as I was telling you, you can have mucosal lesions. So in case of the lips, you can have what we call it as, you can have target lesions. Apart from that, you can have serous crusting. Okay, in case of the oral cavity, you can have what we call it as, you can have vesicles, bullae or erosions. Even eye can get affected. You can have erosions or conjunctivitis in the eyes. And the other mucosa also can get affected in case of EM major. So the prognosis is basically it has got a mild course. It generally subsides within 1 to 4 weeks. Rarely, in case of ocular lesions, you can have scarring. The treatment is to treat the underlying etiology. The role of oral steroids is debatable. It's only in case of severe conditions that we tend to use oral steroids. Antivirals, once the reaction has occurred, basically there is no role for antivirals except in case of EM which is associated with recurrent herpes simplex virus, in which case prophylactic antivirals can be useful. And oral EMs, obviously the treatment will be topicals. Coming to this condition, which is a severe condition, which is an immune-mediated hypersensitivity reaction, which can be life-threatening. It is a mucocutaneous reaction which is characterized by extensive necrosis of the skin. So pathophysiology, as I was mentioning, it is because of the extensive cell death which occurs because of apoptosis. So this is the pathophysiology which occurs. So the main cause of Stevens-Johnson syndrome can be drugs, infections, it can be malignancy related, it can be associated with collagen vascular disorders, but in around 25 to 50% of the cases we can, sometimes we never find the causative organisms and the causative agent. So but in case of TN, around 80 to 95% of the cases are drug related. And in case of the drugs, these are the common drugs which have been implicated in TN, that is antibiotics, especially sulfonamide, beta-lactam, group NSAIDs, anticonvulsants, antiretroviral drugs, antimetabolites like methotrexate. So generally starts on the face and then it affects the upper part of the body. The patient can complain of what we call it as this macular erythema, which is quite tender. The patient will complain of quite a lot of skin tenderness, and then the skin starts peeling. So you can have sheets of peeling skin, leaving raw, painful areas. You can have what we call it as the Nikolsky sign is positive in this case. Now these are the signs and symptoms which when present early can tell us that the patient is going towards Stevens-Johnson's or TEN. So if there is confluent erythema, if there is redness which is affecting quite a lot of your skin, if there is facial edema or central facial involvement, if the skin is tender, if there is necrosis of the skin with epidermal detachments, there is mucosal crusting, there is swelling of the tongue. These are all the signs and symptoms which you need to look out for. So if these are present, then you are taking in terms of Stevens-Johnson's or TEN. So what are the complications? Basically, you can divide it into acute and chronic complications. Acute, basically, because there is so much loss of skin, so the patient can have what we call it as fluid loss, electrolyte loss. This again can lead to renal failure. There can be overlying bacterial infections leading to septicemia. Because it's a hypocatabolic state, it can lead to insulin resistance. The systems can be affected, leading to pneumonitis. And the chronic complications can be that it tends to heal. The ocular lesion can heal with entropion. You can have strictures in the esophagus. You can have phimosis, sinus cave, orogenital ulcers. So early recognition of SGS and PEN is very much important. You need to find out what is the offending agent and withdraw it immediately. Multiple specialists are needed because it is multi-organ. Okay, so you need to involve quite a lot of specialities, and the treatment has to occur in an intensive care setting. So you may need what we call it as critical care intensivist, internal medicine, a dermatologist, infectious disease. To take care of the eyes, you will need an ophthalmology, dietitians as well as plastic surgeons. Sepsis is the major cause of death, so therefore you need to involve, you need to do what we call as careful wound handling is important. You need to do serial swabs in order to rule out infections. So these are the systemic medications which we tend to use in case of SJS and TEN: cyclosporins, oral steroids, etanercept, or intravenous immunoglobulins. Some of the other treatments which have been tried is plasmapheresis and thalidomide. Now coming to this, another severe drug reaction which we call it as stress syndrome, that is drug reaction with eosinophilia and systemic symptoms. Okay, so it's a severe drug hypersensitivity reaction which is characterized by a rash along with underlying systemic upset. That is, rheumatologically you can have eosinophilia and solid organ damage. So what are the drugs which can cause stress syndrome? Sulfur drugs, antibiotics like amoxicillin, tetracyclines, antiepileptics, painkillers. These are the few medications And the investigations basically are to substantiate your diagnosis. That is, you tend to do a biopsy for histopathology, and the other investigations is according to the organ, in order to find out the organ damage which has occurred. So the treatment in case of breast syndrome is stop the culprit drug. In case of skin, you may need to use high potent steroids. You may need to give oral systemic steroids as well. And if steroids doesn't work,
I kindly appreciate and thank Dr. Aruna Sitarami for spending and helping our delegates with your most informative talk. Thank you, madam. Now the session is open for discussion.
Namaste. In the beginning of the session, you told ma'am that small children's skin is having high cutaneous permeation of the drugs. So, high cutaneous permeation might also cause some of the severe side effects. So, how can we prevent these extra side effects or areas in the high extent of cutaneous permeation in the skin?
See, in case of your children, we do tend to go with milder creams. Okay, so if you are using a potent steroid, we tend to go into mild potent steroids rather than going into high potent steroids. Especially in these face areas and things like that, we tend to use hydrocortisone. Okay, instead of using what we call it as dexamethasone or clobetasol. So in the same reactions we see in an adult, I would probably tend to go with a moderately potent or a high potent steroids. But in case of a child, I will reduce the potency so that we don't get these side effects. Okay, and we try to see that we use only a little bit. We tend to educate the parents saying that in case of you go by fingertip units, isn't it? Okay, so in case of using a full fingertip, we tend to ask them to use just a quarter of it or half of it. So we tend to reduce the amount which we are using and we tend to use the strength which we are using. We tend to go lower.
One more question is there, ma'am. It is like some will have very shyness during in their genetic hormones, or some will in the skins are very sensitive for the side effects. So some rashes will be there or severe redness and all will be there. But they are shy to express it. So what are your suggestions, ma'am, that how can they express, how they can express their feeling, and how the confidence they can get to ask or to tell that we are having some problems, but how to express that?
See, generally speaking, when they come to you as a doctor, okay, they are coming with that faith in you and trust in you, okay, basically. So only if they have that faith and trust in you, they will come to you, isn't it?
Yes.
Okay. And then when you are making them comfortable, basically, what we tend to do is like, I tend to take a nurse along with me, okay, close the door, make sure that we are granted the privacy, okay, and then we tend to ask them like, if they are okay with this, because we do need to see what kind of rash it is. So unless and until we have a look at the lesion, it's not possible for us to make a proper diagnosis. Unless we get a proper diagnosis, we are not able to treat it. Okay? So we need to take the patient in confidence. Okay? Make sure that they are comfortable with you. Okay? Offer a chaperone if they want to. Okay? And then ask them if they are okay with us to examine them, then examine them. Okay? But you do need to take them in your confidence and take their consent. Because without taking their consent, it would be an implied consent. But with the implied consent, you need to make sure that you examine the patient. Because without examination, making a diagnosis and then a management plan, that is not possible.
Thank you, ma'am.
I have a question. You explained very nicely about the adverse reactions about the drugs. But what about the cosmetics? Every day we are using facial, lipsticks, all those things. Do you have any such reports on that?
See, we do tend, I concentrate mainly on the severe reactions which we tend to get. But often conditions are quite known to occur associated with all these cosmetics. So history again is very, very important. Okay?
Another question. Are you all explaining dose related and drug related somewhere? This adverse preparation. Is this can be related to the biotransformation metabolism? Is there any dose that can exceed and that biotransformation may lead to this adverse reaction?
Not, it's something which is probably I need to have a look into it, basically. But you guys might be more, is what I would be specialist in telling about it. So I think I might need to jog your information from your actually.
Madam, there is one more question.
Yes.
Most of these cases, this idea can be misunderstood with normal dermatosis or even sunburn or psoriasis.
Yes.
How we can differentiate after single investigation?
We normally, as I was explaining, that we tend to do what we call it as if there is ambiguity regarding the rash, okay, then we do tend to do what we call it as skin biopsy. The biopsy is the investigation of choice, especially in dermatology. So if we have any, the characteristic of the rash is not very specific to that particular conditions, then we do need to do a biopsy because that is the gold standard for diagnosis.
Regarding the management, mostly we will go for that oral or cutaneous corticosteroids. Any other options?
We do tend to use immunomodulators now. So like I was explaining in case of your Steven Johnson's or TEN, we do tend to use cyclosporins. Sometimes we do tend to use methotrexate as well as immunoglobulins has been used. Rare cases they have used thalidomide and things like that. So but those are, only few cases they have documented that other medications. Only they are, the treatment which we tend to use is steroids mostly. Okay, but if that doesn't work, then we tend to use either cyclosporin, methotrexate, immunomodulators.
Thank you, madam. Any other questions?
I would like to thank Dr. Shripati B and Dr. Gigi Jose for being with us as chairperson for the plenary session. I thank Dr. Aparna Sridhar Amin for the wonderful session.
I request our principal, Dr. A.R. Shabaraya, to present a memento and certificate to Dr. Aparna Sridhar Amin. I request our principal, Dr. A.R. Shabaraya, to present a memento to our chairperson, Dr. Shripati B. I again request our principal to present a memento to Dr. Gigi Jose.
Thank you, sir. We request our dignitaries and delegates to have lunch and join us for the afternoon session at sharp 1:30 p.m. And valedictory program will commence at 2:15 p.m. Thank you.
Next category is patient counseling role play. Third prize, Madhuvandapa Lakuni and Kasaba Mamta, Surya Education Trust College of Pharmacy, Dharwad. Second prize, Sharon Elizabeth Shaji and Vivan Wayanad. And it's shared with Priyanka and Ram and Srinivas College of Pharmacy, Nagpur. Jaipur, Rajasthan, and Josna Priya Devi, Srinivas College of Pharmacy, Bangalore, and Akshita Nagaraj Shetty, Srinivas College of Pharmacy, Bangalore. Second prize goes to Amulya D.K., Srinivas College of Pharmacy, Bangalore, and Malayur Suhas Reddy, Srinivas College of Pharmacy, Bangalore. First prize goes to Sahana Yanar, Faculty of Pharmaceutical Sciences, PES University, Bengaluru, and Shilna B.S., Srinivas College of Pharmacy, Bangalore. PG Review. Third prize goes to Tanshipa Fatima, Srinivas College of Pharmacy, Bangalore, and P.E. Venki Logana, Srinivas College of Pharmacy, Bangalore. Second prize goes to Subramanya Pradeep G, Srinivas College of Pharmacy, Bangalore. First prize goes to Sandra Mary Cherian, Srinivas College of Pharmacy, Bangalore. UG Research. Third prize goes to Aishatul Shahala S, Srinivas College of Pharmacy, Bangalore, and Vaishnavi P, Srinivas College of Pharmacy, Bangalore. Second prize goes to Fatima, Srinivas College of Pharmacy, Bangalore. And the first prize goes to Roshan Kutige, PA College of Pharmacy, Bangalore. UGPP. Second prize goes to Aaron D'Souza, Srinivas College of Pharmacy, Bangalore. First prize goes to Marcia, Srinivas College of Pharmacy, Bangalore. Department of Pharmaceutics. PG Research. Third prize goes to Vinita Nayak, Srinivas College of Pharmacy, Bangalore. Second prize goes to Bhuvan Kumar Manjunath Shetty, Srinivas College of Pharmacy, Bangalore. And first prize goes to Nishmita PA College of Pharmacy, Bangalore. PG Review. Third prize goes to Sindhura Pallavi, Srinivas College of Pharmacy, Bangalore, and Adisha V, Srinivas College of Pharmacy, Bangalore. Second prize goes to Yashasvi, Srinivas College of Pharmacy, Bangalore, and Prabhu Shweta Manohar, Srinivas College of Pharmacy, Bangalore. First prize goes to Shetty Dineksha Vijay, Srinivas College of Pharmacy, Bangalore. UG Research. Third prize, Shraddha, Srinivas College of Pharmacy, Bangalore, and Varshita V.A., Srinivas College of Pharmacy, Bangalore. Second prize, Tamshila, Srinivas College of Pharmacy, Bangalore. First prize, Kavana D.K., Srinivas College of Pharmacy, Bangalore, and C.S. Sharan Kumar, Srinivas College of Pharmacy, Bangalore. UG Debate. Third prize, S. Fatima Riza, Srinivas College of Pharmacy, Bangalore. Second prize, Roshni Benito Vegas, Srinivas College of Pharmacy, Bangalore. And the first prize, Anirudh D.M., Srinivas College of Pharmacy, Bangalore. Thank you, sir. Now I request our guest of honor, Dr. G.D. Jose, to give the prize to the winners. The next is Department of Pharmaceutical Chemistry, PG Research. First prize, Kajishma, Srinivas College of Pharmacy, Bangalore. PG Review. First prize, Shiji PM, Srinivas College of Pharmacy, Bangalore. UG Research, second prize, Mitre, Srinivas College of Pharmacy, Bangalore. First prize, Ganush, Srinivas College of Pharmacy, Bangalore. Next is Department of Pharmacognosy, PG Review, second prize, Deepthi Lingappa Mandari, Srinivas College of Pharmacy, Bangalore. First prize, K. Nihara Mahesh, Srinivas College of Pharmacy, Bangalore. UG Review, second prize, Shaibi George, Srinivas College of Pharmacy, Bangalore. First prize, Sharanu K, Srinivas College of Pharmacy, Bangalore. Now we have two special categories for recognizing the winners. So first one is Best Oral Presentation, which goes to Jocelyn Diaz, Srinivas College of Pharmacy, Bangalore. The next category is Best Poster Presentation, goes to Shashidhar, Srinivas College of Pharmacy, Bangalore. Thank you, sir. Congratulations to all the winners, and thank you.
Now, I request the delegates to come forward as we call their name to collect the participation certificate. I request our principal, Dr. A.R. Shivaraya, sir, to hand over the certificate. Anyone from the representative college, please come forward and collect the participation certificate. I request Dr. Muppet's College of Pharmacy, Wayanad, Kerala, to come forward to collect the participation certificate. Anyone representing from the respective college. I request Sony Education Trust College of Pharmacy, Dhara, to come forward. I request PA College of Pharmacy, Mangalore, to come forward to collect the certificates. I request Vishweshwarapura Institute of Pharmaceutical Sciences, Bangalore, to come forward to collect the certificates. Sridevi College of Pharmacy, Mangalore, to come forward to collect the certificate. Best College of Pharmacy, Bangalore, please come forward to collect the certificate.
collect the certificates. I request Sri Singata College of Pharmacy, Tumkur to come forward to collect the certificates. I request Karamali College of Pharmacy, Mangalore to come forward to collect the certificates. I request KED College of Pharmacy, Hubballi to come forward to collect the certificates. I request NEF College of Pharmaceutical Education and Research, Assam to come forward to collect the certificates. Srinivas College of Pharmacy, M.Pharm, please come forward to collect the certificates. I request Srinivas College of Pharmacy, County to come forward to collect the certificates. I request Srinivas College of Pharmacy, B.Pharm to come forward to collect the certificates.
I request our principal, Dr. I request our principal to present a memento to Mr. Madhusudan, Assistant Professor, Department of AIML, for live streaming and media support.
Thank you, sir. Gratitude is the fairest blossom which springs from the soul. As we come to the close of a valedictory ceremony, I invite Gautam of 6th family to propose the ode of thanks.
Good evening, everyone. As we draw this inspiring national conference to a close, it is my esteemed honor to deliver this valedictory vote of thanks. On behalf of the organizing committee, I, Gautam JP of 6th Family, extend our heartfelt gratitude to all who have contributed to the success of this event. First and foremost, I would like to thank our management, A. Shamarao Foundation, for their immense support throughout the conference. I would like to thank our guest of honor, Dr. David Rosario, Medical Superintendent, Srinivas Institute of Medical Science and Research Center, for gracing us with your presence and for inspiring words. Thank you so much, sir. I would like to thank our distinguished chief guest, Dr. Anika Sigwera, Professor and MCU Department of Medicine, Srinivas Institute of Medical Science and Research Center, for gracing us with your presence and for your insightful address. Your words have set a high standard for us and has inspired us all. And also for granting us leave so that we could make invaluable. Your expert insights and perspectives have enriched our discussion and opened new avenues for thought and action in our field. Thank you so much. We are deeply grateful to our respected principal, Dr. A.R. Shabaraya sir. Your unwavering support and guidance have been pivotal in bringing this conference to fruition. Your vision and leadership have been a driving force behind our efforts. Thank you so much, sir. I would like to extend our heartfelt gratitude to the organizing committee headed by Dr. E.V. Subramanian sir, Dr. Satish sir, Dr. Karunakar Reddy sir, Dr. Dinesh K. Chandra sir, and Dr. Kumar Prasad sir for their tireless efforts and meticulous planning. Your dedication has ensured smooth execution of every detail, making this event a resounding success. Thank you so much. To the technical and support staff, your behind-the-scene work has been indispensable, from ensuring seamless logistics to addressing last-minute challenges. Your efforts have not gone unnoticed. I would like to personally thank all the committee in charges and students for their support throughout. Thank you so much. I would also like to thank our student coordinator, Dr. Krishnananda Kamas. Thank you so much, sir. Now I would like to personally thank my family juniors and M.Pharm students who have been there and been there. Thank you for being there and being present whenever required. Thank you so much. I would also like to personally thank Dr. Srinivas sir for smooth conduct of all the programs. Thank you so much, sir. I would like to thank our wonderful delegates and participants. Your curiosity and passion have been driving force behind this event. We hope you will live with renewed inspiration and valuable insights. Thank you so much. And last but not the least, my classmates who have been there from the beginning. This would not have happened without the support of all of you. We have faced many challenges, but we have overcome them, and I can proudly say that we have conducted a successful conference. Thank you so much, guys. As we come to, let us carry forward the knowledge and connections gained here, continue to collaborate and innovate. Together we can achieve great things and make a lasting impact in our respective fields. Thank you all once again and safe travels home. Thank you.
Thank you, Gautam. I request each college representative to come forward for photo session. All students and delegates of each college, please come forward to photo session.
The end of story is the beginning of for many others. On this note, let us conclude our remarkable and memorable valedictory session. On behalf of Srinivas College of Pharmacy, we sincerely thank the dignitaries for being with us this afternoon and enlightening us with their enthusiastic remarks.
I express my gratitude to the professors and everyone of Srinivas College of Pharmacy for their wholehearted support rendered in the success of this valedictory session. Thank you all. Have a wonderful and fun-filled afternoon. Kindly rise for the national anthem.
Dravid Utkala Banga
Dr. Women's College of Pharmacy, Wayanad, Kerala, to come forward for the photo session.
I request Dr. Karunakar Reddy to escort the dignitaries of the days.
ನಾನು ಗಾಡಿಯಲ್ಲಿ ಕೊಂಡು ನನಗೆ ನಾಳೆ ಕಾಲೇಜ್ ಹೋಗು ನಾಳೆ ಪಾಂಡೇಶ್ವರ ಕ್ಯಾಂಪಸ್ ನಾಳೆ ಹೋಗು ಯಾವಾಗ ನಾನು ಮನೆಗೆ ಕೊಂಡು ನಾಳೆ 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 ಸಂಜೆ ನಾನು ಕೊಂಡು ಗಾಡಿಯಲ್ಲಿ ಕೊಂಡು ಹೋಗ್ಲಿಕ್ಕೆ